As you can see from this illustration, trigger points in the suboccipital muscles can cause a wraparound headache pain that can be described as a vice grip. The trigger points in the suboccipital muscles can also restrict our ability to do neck flexion or neck extension. The suboccipitals are particularly troublesome for massage therapists because oftentimes we spend our days looking downward, reaching downward as we treat our clients. One of the greatest tools to use for self-care of the suboccipital muscles is the Backnobber II. You can see there's a smaller curved end and a larger curved end to treat the suboccipital muscles. Place your hand on the bottom of the smaller curved end, your other hand on the top of the larger curve, and we're going to use this hand to press upward while this hand presses downward, creating sort of a teeter-totter effect. We're going to place the knobble end of the tool at the base of the skull right into the suboccipital muscles. When applying trigger point pressure release, you want to hold each location about 2 to 3 breaths. So you can press upward. We'd also like to treat the area we're pressing with the area on the stretch. So we can add an element of flexion or an element of extension. We can also add flexion with rotation. Use the gaze to look up or the gaze to look down. After doing this for 2 to 3 breaths, move the tool again to another spot, about a 1/4 inch away, press down and relax. So trigger point pressure release is a great way to eliminate tension in the suboccipital muscles. The final tip or perpetuating factor is to make sure that you're not sleeping with a head scrunched position. So when you're sleeping, try to maintain as neutral posture as possible. Helpful hint brought to you by Advanced Trigger Point Seminars and Mary Biancalana.